by definition. So the term parenteral hence is used for any drug or fluid whose delivery is outside the intestine. So there are some requirements for parenteral dosage forms in terms of stability should be high, sterility, that is it should be free from microorganisms, then it should be free from pyrogens, that is substance which induces or increases body temperature, and toxins, free from foreign bodies or foreign particles. Then it should be isotonic, that is should have the same osmotic condition as that of blood. Then it should be chemically, physically pure. So first we will see various routes of administration of drugs via injections. So the important aspect of injectable drug is that they enter to the body directly, and it does not require the absorption from GI tract, and hence it is having more rapid onset of action. So these are the various injection routes, namely intravenous, intramuscular, subcutaneous, intradermal, intraarterial, intracardiac, intrathecal, intracisternal, peridural, intraarticular, and intracerebral. So intravenous refers to the injection of drug directly to the patient vein, hence its results most rapid onset of action, and the bioavailability is also very high in IV routes. Intradermal means it is the application through across the skin, and ideally it is placed in the dermis. Especially this route is applied for some diagnostic agents. Then subcutaneous refers to the injection of drug into two or more layers of the skin, and hence the absorption is rapid. The commonest route of administration is insulin. Then intramuscular means it is the administration of deep into the muscle tissues, and it is mainly done for non-aqueous oily solutions or suspensions, etc. It can prolong the duration of drug release. Then some special route include intraarterial, that is to the artery, intracardiac, directly into the emergency conditions of heart, muscles, and ventricles. Intrathecal means it to the subarachnoid space surrounding the spinal cord, commonly employed for giving anesthesia, spinal anesthesia. Then intradermal is also used for CSF collection for diagnostic purpose. Peridural means similar to the intracisternal route, inner and aspects where you get the access to the vertebral space. Articular means into the junctions, especially for knee joints. And intracerebral means drugs given to the cerebrum. So these are the advantages of parenteral routes. So it is useful for drugs which are not given through oral route. The important aspect is that it is having a rapid onset of action, and it is helpful in emergency situations. Also gives some sort of sustained or prolonged duration of action. The first pass metabolism can be overcome, especially the drug targeting can be achieved, and TPNs, total parenteral nutrition, can be given through parenteral routes. Okay, and it is very helpful for ambulatory and hospital clinical setup. Okay, then some disadvantages involves pain upon injection at a particular tissue or at the site, and once the drug is given, it cannot be reversed by simple stoppage, and sensitivity or allergic reactions to certain drugs. Then the strict control of sterility and pyrogenicity is very important. An injection requires training, requires specialized equipments and methods or setup for preparation, hence it is a costlier method. Then you have two types of parenteral preparations, that is SVP, small volume parenterals, and large volume parenterals. So those which are given in bulk exceeding more than 100 ml are called large volume, and injections given through ampules, vials, or less than 30 ml or 100 ml is called as small volume parenterals. Okay, so commonly injections of drugs are given as a small volume for particular therapeutic purpose, and small volume parenterals commonly given is a TPN, that is for giving the calories, fluid repulsion, electrolyte, or combination of the above. So more than 100 ml are called large volume. So these are the various differences. So in terms of the sterility, large volume parenterals having high upper hand, and the specific requirements are also there. Then we'll move into the formulation requirements. So you have a different types of ingredients needed for formulation of injections. So the most common ingredient is a vehicle. So there are two types of vehicles: aqueous vehicle and aqueous vehicle. Aqueous vehicle include water for ingestion, sterile water for ingestion, and bacteriostatic water. So water for ingestion, WFI USP, is a highly purified water used as a vehicle for ingestion preparations and are subsequently finally sterilized. So it's essentially having a pH of 5 to 7, and they are prepared, WFI prepared either by steam distillation or reverse osmosis. Bacteriostatic water for ingestion are not terminally sterilized and also similarly prepared under aseptic conditions, and it also contains the antimicrobial agents to prevent the bacterial growth. Then sterile water for ingestion, SWFI, contains one or more bacteriostatic agents and also sometimes supplied with the dry powder, that is a lyophilized powder product, and they are commonly preferred for multiple dose containers not exceeding 30 ml. This is having a disadvantage because of the leaching of the content from the containers into the solution, are commonly used for washing purposes and surgical purposes. Then some water having property similar to water can also be employed, like ethyl alcohol, glycerin, liquid propylene glycol, etc. So it also gives some aqueous solubility of drugs. The non-aqueous vehicles mainly includes oils, mainly mixed oils, peanut oil, corn oil, cottonseed oil, sesame oil, soybean oil, etc. are some of them. Now the other added substances include first one, antibacterial agents. So these are added in multiple dose containers and they primarily function is to prevent the microbial growth. So the concentration is very peculiar for some of the antimicrobial agents. Commonly used one are phenyl mercuric nitrate and thiomerizole, then benzalkonium chloride, benphenol can also be used, chlorobutyl. The concentration is very important. Then buffers are added to maintain the particular pH, and are also used to stabilize a solution from chemical degradation. The commonly used buffer systems include citrate buffer, acetate buffer. They are having acidic pH, and sodium benzoate and benzoic acid, sodium tartarate, tartaric acid, and phosphate buffer are some of them. Then antioxidants, these are used to protect the formulation from subsequent oxidation. And there are two classes of antioxidants. Class 1 is called reducing agents, which include ascorbic acid, sodium bisulfate and thiosulfate, thiourea, etc. Then some blocking agents are also there, which entrap the oxidizing moiety. Commonly include blocking agent is tocopherol. Then surfactants are also some of the ingredients which uses to solubilize the active ingredient API when it is not water soluble. So the most common used surfactant is polyoxyethylene sorbitan esters, that is twins and spans. Then tonicity agents, these are added to make the solution isotonic to blood, otherwise it will destruct the RBC, or reduces tissue damage or induces tissue damage also. So commonly used tonicity builders are sodium chloride, potassium chloride, dextrose, mannitol, and sorbitol, etc. Then chelating agents are added to remove the trace elements such as lead, copper, etc. heavy metals. EDTA is the most commonly used chelating agent, and some co-solvents can also be used. Bulking agents, suspending agents are there when the product cannot be made into a simple solution. So commonly used suspending agents are CMC, gelatin, sorbitol. Emulsifying agents also plays into action. Then we'll focus on preparation of WFI. So WFI essentially should be clear, colorless, odorless, and should be pyrogen free, and also it contains no added substances. So generally they are prepared from potable or purified water by distillation or reverse osmosis. Okay, so just go through the preparation steps. This is the still which is employed. Multiple processes also. The reverse osmosis is done through a membrane separated by two aqueous solution of different concentration, and millipores and aquachems are some of the commonly used semi-permeable membranes. Then storage is very particular. Distillate is collected, and it should be stored at room temperature for maximum of 1 day. Then large volume parenterals means they are the sterile, non-pyrogenic, free from particulate matter, Generally, they are supplied in bottles of having volume 100 to 1000 ml and are single dose units. No preservatives. From the difference which is clear now, in preservative or microbial agents are all added. Generally they are given for giving nutrition, that is called TPN. So these are the various type of large volume parenterals, that is hyper elementary solutions, cardiopelagic solutions, peritoneal solutions used for dialysis, and irrigation solutions used for surgical procedures. So hyperalimentation, so generally it is contain dextrose, amino acids, electrolytes and vitamins. This is the commonly used TPN formulation. Generally contains dextrose, nitrogen source is amino acid, and electrolytes sodium, potassium, chloride is also there. Water soluble and fat soluble vitamins also included along with some trace elements. So this is done for undernutrition the peoples who on bed side, by infusing a mixture of the TPN into the circulatory system. And cardiopelagic is also used for cardiac procedures. Peritoneal solution used for removing the unwanted substances from abdominal cavity. For kidney failure patients, then irrigating solutions are used to flush or aid the cleaning body cavities and wounds during dressing procedures, and some sterile normal saline solutions are used parenterally for during the open surgical procedures. So these are the various type of LVPs which is commonly in use and their purpose. The small volume parenterals include simple solutions, suspension, emulsions and dry powders. So solutions are typically used for delivering medicines at controlled infusion rate. Commonly contains saline 0.9 percentage. Then suspension mainly applied for IM and subcutaneous administration. When you cannot make a simple solution, commonly used one are penicillin G, then emulsions. Dry powders are produced by freeze drying or spray drying purpose. So they are commonly used to overcome the intrinsic instability of the drug, or sometimes are called the injections are used for reconstitution and are supplied with the sterile water for injection